Extensor Carpi Ulnaris synergy test. We have no relevant disclosures. So the ECU extends and ulnarly deviates the wrist and provides stability to the ulnar side of the wrist. And ECU tendonitis is one of the many differentials of ulnar-sided wrist pain. We can see here the ECU tendon runs adjacent to the ulnar head, inserting onto the base of the fifth metacarpal. In order to perform the ECU synergy test, you have the patient flex their elbow, supinating the hand, and over here we can identify the ECU readily. And then we get them to forcefully abduct their thumb and long finger, as you can see here. And the test is positive if the patient reports onset of their pain. And so again here, we get the patient to forcefully abduct their thumb and long finger against resistance and are checking for tenderness and pain along the path of the ECU. And this indicates a positive test for ECU tendonitis.